What if I told you that constant fatigue, unpredictable mood swings, and those frustrating memory lapses aren't just signs of getting older, but actually red flags your body is desperately trying to send you? You see, millions of people are walking around right now feeling drained, overwhelmed, or just not quite themselves, and most have no idea why. Imagine this: you wake up after a full night's sleep, but instead of feeling refreshed, you feel like you've just run a marathon. You're yawning constantly, dragging yourself through the day, and no amount of caffeine seems to help. You tell yourself it's just stress, or maybe a tough week, but days turn into weeks, and you still feel the same, tired, foggy, and strangely disconnected. Or picture this: you used to be upbeat, full of energy, and ready to take on anything life threw at you. But lately, your emotions are all over the place. One moment you're anxious and irritable, the next you're feeling down and lost. You start questioning yourself. Maybe you're just being too sensitive. Maybe it's just life. But deep down, you know something isn't right. What if I told you that all these symptoms, fatigue, mood swings, even memory problems, could be traced back to one simple, often overlooked issue: a vitamin deficiency? Specifically, a lack of vitamin B12. Vitamin B12 is like the unsung hero of your body, working tirelessly behind the scenes to keep your brain sharp, your nerves healthy, and your energy levels steady. But when your body doesn't get enough of it, everything can start to fall apart, physically, mentally, and emotionally. In today's video, we're diving deep into the 8 strange but critical signs that your body is begging for more vitamin B12. You might be surprised to see how many of these hit close to home. Stay with us, because understanding these signs could literally change your life. Why vitamin B12 is crucial. Let's be honest, most of us don't give much thought to vitamins unless we're feeling under the weather or dealing with a health scare. But there's one vitamin that quietly works behind the scenes, keeping our bodies functioning properly. And when we're low on it, the consequences can be surprisingly severe. That vitamin is B12. Vitamin B12 might not get the same hype as vitamin C or D, but it plays a crucial role in your health. Think of it as the powerhouse that helps your body produce red blood cells, supports brain function, and even aids in DNA synthesis. In other words, it's essential for keeping your mind sharp, your nerves healthy, and your body energized. But here's the scary part. Millions of people are walking around dangerously low on B12 without even realizing it. And because the symptoms can be subtle or easily mistaken for other issues, like stress, aging, or lack of sleep, many don't even know they're at risk. To help break it down, let's meet Dr. Claire Hamilton, a compassionate nutritionist who's seen it all. In her years of practice, she's met patients from all walks of life: busy parents, career-focused professionals, and older adults, who come in complaining of fatigue, mood swings, or brain fog. Most are shocked when they find out their symptoms are linked to something as simple as a vitamin deficiency. So why is B12 deficiency so common? It turns out that our bodies can't produce B12 on their own. We have to get it from our diet or supplements, and while foods like meat, fish, eggs, and dairy are rich in B12, people who follow plant-based diets, older adults, or those with certain medical conditions often struggle to get enough. That's why it's so important to recognize the signs early. If left untreated, low B12 can lead to long-term problems, from nerve damage to severe cognitive decline. But the good news? Once you understand the symptoms and know how to increase your B12 intake, you can start reclaiming your energy, mental clarity, and overall well-being. Stay with us as we reveal the strange but critical signs your body might be begging for more B12. Symptom 1: crushing fatigue and weakness. Imagine this. You're a hard-working single mum named Rachel. Your days are filled with juggling work, school drop-offs, and endless household chores. You pride yourself on being resilient, pushing through. Exhaustion because, well, life doesn't slow down. But lately something's different. No matter how much sleep you get or how many cups of coffee you drink, you feel like a walking zombie. Getting out of bed feels like dragging a ton of bricks, and you catch yourself yawning in the middle of important meetings. Rachel tries everything: more sleep, healthier meals, extra hydration. But nothing seems to help. Eventually she starts doubting herself, wondering if maybe she's just being lazy or not trying hard enough. But deep down, she knows something is wrong. If this sounds familiar, you're not alone. One of the earliest and most common signs of a vitamin B12 deficiency is persistent fatigue and weakness. You see, vitamin B12 plays a key role in producing red blood cells, which are responsible for carrying oxygen throughout your body. Without enough B12, your body can't make enough healthy red blood cells, and as a result, less oxygen reaches your muscles and tissues. That's why you feel constantly drained, sluggish, and even physically weak, no matter how much rest you get. The scary part? Many people brush off this crushing fatigue as just part of modern life, stress, overwork, or lack of sleep. But it's not normal to feel like you're trudging through quicksand every single day. Ignoring it can lead to more severe complications. Down the line, Rachel eventually visits her doctor, and after some routine blood tests, the results come in. Her vitamin B12 levels are alarmingly low. A simple B12 supplement and some dietary changes later, she finally starts feeling like herself again. It's a revelation. If you've been feeling constantly tired and weak for no apparent reason, don't just chalk it up to stress or burnout. Your body might be desperately trying to tell you something. Don't ignore it. Getting your B12 levels checked could make all the difference. Symptom 2: depression, anxiety, and mood swings. Meet Alex, a bright, ambitious college student who's always been known for his positive attitude and unwavering drive. But recently, things have changed. Alex finds himself battling mood swings that come out of nowhere. One moment he's anxious and on edge, the next he's overwhelmed with sadness. He's never felt like this before, and it's starting to affect his studies and social life. Friends ask if he's okay, but he just shrugs it off, telling them it's just stress from exams. Deep down, though, he knows something doesn't add up. Mental health can be a complex and deeply personal journey, but did you know that something as simple as a vitamin deficiency could be playing a big role? Vitamin B12 is directly linked to your mood and mental well-being. It's involved in producing essential brain chemicals like serotonin, the one often called the feel-good chemical. When your B12 levels drop, your body struggles to produce enough serotonin, leaving you feeling more anxious, irritable, or even depressed. The problem is, most people never suspect that their emotions could be influenced by a nutrient deficiency. Instead, they might blame stress, life changes, or even their own mental resilience. Alex, for example, chalked up his emotional roller coaster to college pressure. But when his anxiety started affecting his sleep and his ability to concentrate, he decided to seek help. After a thorough consultation, his doctor suggested a blood test, suspecting a vitamin deficiency. The results? Low B12 levels. A simple supplement routine and some changes to his diet made a world of difference. Within weeks, Alex started feeling more like himself, balanced, focused, and emotionally stable. If you've been dealing with unexpected mood changes, irritability, or feelings of anxiety or depression that just don't seem to make sense, it might not just be in your head. Sometimes it's your body's way of crying out for a boost of B12. Don't let an unseen deficiency steal your peace of mind. Taking a closer look at your nutrition could be the key to feeling better. Symptom 3: pale or yellow-tinged skin. Imagine catching your reflection in the mirror and noticing that your skin looks unusually pale or even has a faint yellowish tint. You might dismiss it as being tired or stressed, but what if it's actually a sign of something more serious? One of the lesser-known symptoms of a vitamin B12 deficiency is changes in your skin color. Your skin might appear paler than usual, or you might notice a subtle yellow hue, almost as if you're constantly under warm, dim lighting. While it might seem like just a cosmetic issue, this change in your skin tone could be a red flag your body is waving to get your attention. Here's why this happens. Vitamin B12 is crucial for producing healthy red blood cells. When your body doesn't get enough B12, it struggles to produce these cells efficiently. Instead, the existing red blood cells break down faster, releasing a substance called bilirubin into your bloodstream. Bilirubin is the yellow pigment that can make your skin look jaundiced, similar to what you might see in newborns or people with liver issues. Don't mistake it for just being tired or worn out. If you've noticed your skin appearing unusually pale or yellow, it's time to consider checking your B12 levels. It could be your body's way of signaling that it needs more of this vital nutrient. Sometimes, a simple supplement or dietary adjustment can make all the difference. Symptom 4. Mouth pain and glossitis. Have you ever noticed your tongue feeling unusually sore, swollen, or even strangely smooth? Maybe eating your favorite foods has suddenly become uncomfortable, or speaking feels oddly painful. It might seem like just a random irritation, but your mouth could be telling you something important. Your body might be craving more vitamin B12. One of the more visible signs of a B12 deficiency is glossitis, which is just a medical term for an inflamed, swollen, and sometimes bright red tongue. Normally, your tongue should be pink and covered with tiny bumps called papillae. But when your body lacks enough B12, it disrupts the production of healthy red blood cells, leading to inflammation and changes in the surface of your tongue. But it doesn't stop there. You might also develop small, painful sores inside your mouth, on your cheeks, lips, or under your tongue. These ulcers can make eating, drinking, and even talking quite uncomfortable. It's not just about the physical pain. It can impact your quality of life, making meals and conversations a struggle. If you've noticed these symptoms, don't ignore them. A sore, inflamed tongue might seem minor, but it could be your body's way of telling you it's running low on B12. Take it seriously and consider getting your levels checked to find some much-needed relief. Symptom 5. Pins and needles, numbness. Imagine sitting at your desk trying to focus on your work, when suddenly you feel a weird tingling sensation in your hands or feet. It's like tiny needles are poking you from every angle, or maybe your limbs feel numb and unresponsive. You shake it off, thinking you just sat awkwardly for too long. But what if this uncomfortable feeling keeps coming back, even when you've been moving around? That strange pins and needles sensation, or numbness, is more than just annoying. It could actually be a sign of vitamin B12 deficiency. You see, B12 plays a critical role in maintaining the health of your nerves. It helps produce something called the myelin sheath, a protective coating around your nerves that ensures signals travel smoothly throughout your body. Think of it as the insulation on electrical wires. Without it, the signals can become weak, slow, or completely disrupted. When your body doesn't get enough B12, the myelin sheath can start to break down, leading to nerve damage. This is why you might experience tingling, numbness, or even burning sensations, especially in your hands and feet. While it might seem like a minor issue at first, ignoring it can have long-term consequences. If left untreated, this nerve damage can become permanent, affecting your coordination, balance, and even your ability to move around normally. Take this symptom seriously. If you've noticed recurring tingling or numbness that doesn't seem to have an obvious cause, it's time to get your B12 levels checked. Early intervention can make a big difference, preventing lasting nerve damage and helping you regain your sense of normalcy. Don't let a simple deficiency silently compromise your mobility and quality of life. Symptom 6. Irregular heartbeat and palpitations. Imagine sitting quietly, maybe reading a book or watching TV, when suddenly your heart starts racing out of nowhere. You feel it pounding in your chest, almost as if it's trying to escape. Your breathing becomes shallow, and a wave of anxiety washes over you. It feels scary, like something is terribly wrong. Irregular heartbeat, also known as palpitations, can be one of the more alarming symptoms of a vitamin B12 deficiency. But why does it happen? The answer lies in how B12 affects your heart and blood. You see, B12 plays a crucial role in producing red blood cells that carry oxygen throughout your body. When you're deficient, your red blood cell count drops, leading to a condition known as megaloblastic anemia. This type of anemia means your heart has to work harder to pump oxygen-rich blood to your organs. As a result, you might experience a faster or irregular heartbeat, sometimes accompanied by dizziness, shortness of breath, or even a feeling of panic. Left untreated, this strain on your heart can lead to more severe issues, including heart complications. Don't ignore these signs, especially if they happen frequently or without a clear cause. An irregular heartbeat isn't just a temporary inconvenience. It's your heart's way of signaling that it needs support. Getting your B12 levels checked and adjusting your intake might be the key to calming your heart and restoring your peace of mind. Symptom 7. Brain fog and memory issues. Imagine sitting at your desk, staring at your computer screen, trying to remember why you opened that document in the first place. Or maybe you walk into a room and completely forget what you needed. These little memory lapses and moments of confusion start to happen more frequently, and you can't help but wonder, am I just getting older, or is something else going on? If you've ever experienced this kind of brain fog or noticed your memory slipping, you're not alone. While it's easy to blame stress or aging, sometimes the real culprit is a lack of vitamin B12. You see, B12 is essential for maintaining healthy brain function. It helps form the protective myelin sheath around your nerve cells, ensuring that signals in your brain are transmitted efficiently. Without enough B12, this protective layer can break down, leading to slower communication between brain cells. The result? You might feel forgetful, disoriented, or struggle to concentrate on even the simplest tasks. Some people describe it as feeling like their brain is wrapped in a thick fog. Thoughts just don't come as easily as they used to. Over time, this can escalate from occasional forgetfulness to more serious cognitive issues, including memory loss or even dementia. For someone like Mark, a tech engineer in his 40s, these memory lapses became a daily struggle. He feared early-onset dementia until a simple blood test revealed his B12 levels were critically low. After supplementing, his focus and memory improved significantly, giving him back the mental clarity he thought he'd lost for good. If your memory feels a little too fuzzy lately, don't just brush it off. It might not just be stress or aging. Sometimes it's your body's way of telling you it needs more vitamin B12. Taking action now could help you stay sharp and focused in the years to come. Who's most at risk? You might be wondering, am I at risk of vitamin B12 deficiency? The truth is, anyone can develop low B12 levels, but some groups are more vulnerable than others. Understanding your risk factors can help you take proactive steps to protect your health. One of the most at-risk groups are older adults. As we age, our bodies become less efficient at absorbing B12 from food. This means that even if your diet hasn't changed, your body might still be running low on this essential vitamin. Additionally, people with gastrointestinal disorders like Crohn's disease, celiac disease, or chronic gastritis are at higher risk since their bodies struggle to absorb nutrients properly. Vegans and vegetarians are also at significant risk. Since B12 is mainly found in animal products such as meat, dairy, and eggs, those who follow plant-based diets might not get enough through food alone. Without proper supplementation, deficiency becomes a real possibility. Certain medications can also affect B12 levels. For example, people taking metformin for diabetes or proton pump inhibitors for acid reflux may experience decreased B12 absorption. Even younger, seemingly healthy individuals can be affected if they don't consume enough B12-rich foods. It's not just about diet. It's also about how well your body can process what you consume. If you fall into one of these groups or have been experiencing symptoms, it's worth talking to your healthcare provider. A simple blood test can give you the answers you need and help you take the right steps toward better health. What to do about it? Diet, supplements, testing. If you've recognized any of the symptoms we've discussed, you might be wondering, what now? The good news is that vitamin B12 deficiency is often easy to manage once you know the problem. Here's how to take control and boost your B12 levels. First things first, get tested. A simple blood test can reveal whether your B12 levels are low. Talk to your healthcare provider about your symptoms and don't hesitate to request a test. It's quick, straightforward, and can give you valuable insights into your health. Next, let's talk about diet. The best natural sources of B12 are animal products. Lean meats, fish, eggs, and dairy are all rich in this essential vitamin. If you're up for trying something a little different, organ meats like liver are incredibly B12 rich, though they might not be everyone's favorite. If you follow a vegan or vegetarian diet, make sure to include fortified foods, such as cereals and plant-based milk, which can provide a valuable source of B12. Sometimes, dietary changes alone aren't enough, especially if your body struggles to absorb B12 from food. In these cases, supplements can be a lifesaver. The most effective form is methylcobalamin, which is often available as a sublingual tablet that dissolves under your tongue, making it easier for your body to absorb. For severe deficiencies, your doctor might recommend B12 injections to get your levels back on track quickly. Remember, catching a deficiency early makes it much easier to reverse the symptoms. Don't wait until fatigue, mood changes, or memory issues disrupt your life. With the right combination of testing, diet adjustments, and supplements, you can restore your energy, mental clarity, and overall well-being. Take charge of your health. Your body will thank you for it. Your body is remarkable. It knows how to send signals when something's not quite right. Fatigue, mood swings, tingling in your hands and feet. These aren't just random inconveniences. They're your body's way of saying, "Help me." The truth is, you don't have to live in a fog of exhaustion or frustration. Sometimes the answer is simpler than you think. Imagine waking up with energy that lasts through the day, feeling emotionally balanced, and having a clear mind to focus on the things you love. It's not a distant dream. It's possible when you give your body the nutrients it desperately needs. Don't let vitamin B12 deficiency silently steal your quality of life. You deserve to feel vibrant, strong, and mentally sharp. If anything we discussed today resonates with you, take that first step. Talk to your healthcare provider, get your B12 levels checked, and make small but impactful changes to your diet. Maybe it's as simple as adding more B12-rich foods to your meals or taking a supplement. You have the power to take control of your well-being. Don't let this chance slip by. And remember, you're not alone in this journey. So many people are unknowingly battling B12 deficiency, just waiting for a solution. Share this video with friends and family. They might be experiencing these symptoms too. By spreading awareness, you could help someone regain their health and happiness. If this video opened your eyes to something important, give it a thumbs up and hit subscribe. Let's continue exploring ways to live healthier, more fulfilled lives together. Until next time, take care of yourself and listen to your body. It's counting on you.